So the article that the four of us have written is about the Witness to Witness program, which started at a workshop in June of 2018. And it was actually a response to one of our co-authors, Deliano Garcia, who was talking about the impact on frontline workers of being at the border, working with people in various stages of the immigration process. And we began the program really in response to that and began working with healthcare workers and attorneys and people who were supporting healthcare workers and attorneys, primarily at the border. And then it became quite clear that the need for services was really all over the country. We started out, there were 4 components. We did webinars, organizational consultation, peer support groups, and one-on-one conversation. And then in the summer of 2019, things really began to escalate. Our numbers increased tremendously. And we moved from what had started out as 8 volunteers to 38, 6 of whom were bilingual. Celia Falikov joined and became the head of Spanish language programming. And we also started to outgrow our affiliation with the American Family Therapy Academy. And we were very fortunate to have some connections through Del Garcia with Migrant Clinicians Network.
And Kata, finding you was just a godsend as far as I'm concerned for MCN, because in our 35 years, our work has always been trying to support clinicians in their workplaces, often isolated and without many resources, to be able to be successful in their work in caring for migrants. And more in that period when I first met you, what I could see is what they were witnessing on behalf of their patients in the exam room, and what those attorneys were listening to when they were speaking to their clients in those small interview rooms in detention centers was more than their spirit could really bear. And what became very clear to me, and I didn't realize that there was an answer, and that's why Witness to Witness is such a godsend, is that I could feel the weight on those colleagues to the point where clinicians were saying to me, I need to leave medicine. I can't do this anymore. I'm delighted that we got to write this article, and I think if more people understood the value of Witness to Witness, it could grow even larger.
Saul, you're a volunteer.
Yes, so I became a volunteer with Witness to Witness in 2019, starting with the part of the program that we're talking about, these one-on-one conversations, and had the pleasure of having many conversations with people around the country about their work, their commitment to the immigration crisis, and their personal needs of finding ways to take care of themselves and also continue their incredible work. With an incredible team, with Alma, with Del, with you, Celia, and many others, became part of how do we do this work for our Spanish-speaking healthcare workers that are part of MCN. And we created a program, an adaptation, like Alma always calls it, of the W2W curriculum to Spanish, taking into account culture and the needs of the workers, not only for who they were supporting, but also for themselves.
Alma, tell us more about the program.
Well, Kata, it started with the Witness to Witness conducting a webinar for Ventanillas de Salud community health workers on coping with the stress product of the current pandemic. They requested more support on grief, coping, and resilience. As a response, we designed 3 virtual sessions on those topics and even more. Sol and you developed a W2W Train of Trainers curriculum. The curriculum was adapted to a Latino audience, and then 4 Spanish-speaking behavioral professionals were trained. The pilot is an innovative and concrete public health intervention during this pandemic, providing fully in Spanish, it's totally in Spanish for a population that lack culturally appropriate mental health services in their languages.
Yeah, so W2W is just thrilled to be collaborating with so many talented and committed people where the values are strong and the values are shared. And I think the other part that I hope the paper conveys is that we don't see any difficulty with doing really top-notch clinical work and activism. And this is a moment, if there ever was one, where activism is absolutely essential.
Essential.
Thank you.
I agree.